welcome back. A day after the Maharashtra government reconciled the number of COVID-19 deaths in the state and added 1,300 fatalities to the death toll, a circular was issued by the BMC regarding testing reports, which has now sparked controversy. The BMC says that private laboratories in the cities can test people, but they cannot hand over the report to people who test positive for COVID-19. It has to then go across to the BMC. The BMC will verify. They will then inform the person and advise the person what that person has to do and which hospital and which bed and which hospital they have to go to. This is exactly what's going to happen. The BJP has opposed the move, saying that the BMC is indulging high-handedness and has written to the municipal commissioner seeking withdrawal of the circular. There is also allegation by the BJP and also the MNS that the city's civic body's move could also affect the patients, as with these new rules they will have to wait longer to get treated. Also, there is allegation that there is a certain level of fudgery of the numbers. The real numbers are being hidden in Mumbai. Shaina NC and Sanjay Jha with us. Imagine, good evening, thank you very much. Let's go across to this face-off between the BJP and the ruling disposition there. And Sanjay Jha is a political analyst and also a Congress leader, not a Congress spokesperson. Is COVID truth being hidden in Mumbai? Is a straightforward question. Imagine, Sanjay Jha, I'm happy that you've recovered, but in your case, had you gotten yourself tested, but then you can't decide, you will not get the report. The BMC will decide, and then you will have to go where the BMC tells you to go.
Well, you know one thing, Anand, from your question, unfortunately, I had to go and take another call, so I wasn't there when you started the program. As far as Mumbai is concerned, and I live here, so I can give you a very honest description of the way the city is being handled. The positive metric that has emerged, in fact, since yesterday, is that the doubling period, the number of days has gone up. And I'm not going to deny the fact that Mumbai remains, even as we talk, extremely vulnerable to further transmissions. And, the fact that the city has opened up, and that does make it prone to possibly more infections as well. I think what the BMC, as far as transparency is concerned, let me assure you, I don't know where the confusion has happened on the BMC side, but there is absolutely no question.
Logic behind this kind of a rule, Sanjay, please understand. What is the logic behind this rule? Is there any logic behind this rule? Ki bhai, I go to a lab, I get myself tested, and if I am COVID positive, the lab will not give me the report. The lab has to give it to the BMC. Because what's our argument here? That asymptomatic people will go themselves.
No, I'll tell you what is a positive here. In fact, I don't see that as a negative, Anand. I'll tell you why. Because supposing an individual believes that he or she is COVID symptomatic, and let's assume the test, unfortunately for the individual, turns out to be positive. Now, what happens is the lab, if it were to give the report to the individual, you see, very often individuals could possibly not make a disclosure. So the fact that it goes first to the BMC ensures that the government, because it is ultimately a municipal corporation,
the lab will make a disclosure. The lab will send the result to the BMC. The person does not need to make a disclosure. The lab will send the result. The argument here is that the person will rush to a hospital and occupy a bed despite being asymptomatic. But let me ask you, Sanjay, let me ask you, Shaina NC, if Sanjay has recovered already, I'm just saying, if you are found COVID positive, let's hope that all is well with you, Shaina. But in that case also, as an individual, if you are asymptomatic, would you want to go and admit yourself in hospital? Even if you have mild symptoms, you would prefer to home quarantine, won't you?
Absolutely. And look at the current scenario, Anand. This is an absolute panic where the administration is not even sure of what it's doing. Everyone who is asymptomatic would want to self-treat and want to self-quarantine at home and take care of all measures. But why have we reached this stage today? Because there is no tracing, there is no testing, there is no treatment. And unfortunately, what issue was which we raised, which was clearly that the state government itself had set up this so-called death audit committee to, at a district level, at a municipal corporation level, to find out who are the people who are dying of it, who are the people who have died of other diseases, and there has been mayhem because the reporting at the municipal corporation has been so pathetic. You have had a case in the Maharashtra government's own circular which said that decision on whether somebody dies of COVID or not should be decided in 7 to 10 days. You had 560 cases in May, 148 cases in June, which haven't even been decided by the Death Audit Committee of Mumbai. How can you expect us under this circumstance to trust, even if there is a testing and if the BMC is going to hold these reports? How is anyone going to trust after this kind of hiding? I think the importance here is that the WHO and ICMR have set certain guidelines. They have set certain systems in place. But obviously the Death Audit Committee is not working. The BMC is too worried to report, under-report, over-report, or even report in terms of death. So how can you blame the citizens? The citizens are only going to doubt this kind of a lackadaisical approach where you have one issue, one guideline which is being issued today and something else which is being said tomorrow. If I go and test myself and if I am positive or if I'm not, it is my prerogative if I want to self-quarantine at home or admit myself. It is not the prerogative of the BMC, who hasn't even reported the thousands of people who have died, unfortunately.
Not just that. Not just that, Sanjay Jha, please tell me. See, Sanjay Jha, the person who's COVID negative knows immediately, but the person who's COVID positive will have to wait maybe 24 hours, 48 hours, if not more. You please tell me, in this current system, the BMC, how long is the BMC going to take to come back and allocate a bed or advise you and call that person, if they're going to call these people? You know what the daily number of cases in Mumbai are? Daily number of cases, कम से कम 1200 से 1500 cases हो रहे हैं. ठीक है? 1200, if not more. Right? 1200 से 1500. And you are expecting the BMC to call you. कब call करेगा? 3 दिन, 4 दिन बाद. And if this person in that 4 days, 5 days, this person does not know what to do. If this person does not know if that person is COVID positive, that person is not going to quarantine. That person is going to perhaps meet more people, spread it further. What if it is not asymptomatic and pre-symptomatic?
Yeah, Anand, very, very, very quickly. If a person goes for a test for COVID and tests positive, the one basic thing that we need to communicate through your channel to whoever is watching the program, and I'm sure there are many, is that if you're asymptomatic, which means very or mild symptoms, even moderate symptoms, then if you even read ICMR or any other such regulation anywhere in the world, it is recommended to go for home quarantine. Hospitals is only meant for extremely severe cases where the infection is very strong.
Correct.
And therefore, one of the risks that people...
Sanjay, what was your first instinct? Sanjay, what was your... You had mild symptoms. Sanjay, you had mild symptoms. You've recovered from COVID. You please tell me your own mental makeup. Let me ask you: did you want to go to a hospital or did you want to stay home? Every other patient who's mild, who's asymptomatic, who does not have, I will not go and admit myself if I've got a fever into a hospital.
Absolutely.
I will stay at home. And if it is COVID, if it is a COVID-related fever, I will stay at home and recover. If I have breathing problems, if my condition deteriorates, then I'll go to a hospital. My last resort is go to a... That's a natural instinct. And the health minister of Maharashtra turns around and says, "लोग asymptomatic लोग hospital bed occupy कर लेंगे, इसके लिए हमको ऐसा करना पड़ रहा है." नहीं, sir.
Well, Anand, I kind of believe that there are, again, this is something that, I don't want to get into this territory. But the fact is there are different kinds of people. You are absolutely right. I believe that anybody with a mild symptom, even a moderate symptom, needs to be on home quarantine, and with basic treatment, everyone will recover. I really don't see that there's any reason for panic there. But yes, I mean, there could be people. I'm not saying that, possibly we can generalize. But there could be people who are, a lot more worried or anxious, and they would say, well, just get into a hospital and, you'll be discharged maybe earlier than what it would be in a home quarantine. So I think possibly it's a calculated risk. I agree with you. I agree with you that these policies need to be looked at on a case-to-case basis. But more importantly, if you have enough hospital beds, there'll be no need to panic. And in fact, I would say that if somebody is extremely anxious and wants to get admitted into a hospital, and there is a hospital bed available, so be it. But you don't want a situation. There's one situation the government cannot afford, which is that somebody seriously and critically needs a hospital bed and does not get it. That will be a serious problem.
Sir, 3,752 cases across Maharashtra, 100 new deaths. Total number of deaths is 5,751. Total number of discharged patients are 1,672. Mumbai total cases is 62,875. 3,311 is the total number of deaths total number of deaths, and now the BMC has said 48-hour thing to any of the hospitals to report any COVID pending deaths within 48 hours. BMC is telling the hospitals, you report COVID pending deaths. I thought, China NC, you just said that there is a separate committee which is going to audit and decide whether these are COVID deaths or not. Now they are putting it on hospitals, saying hospitals are not declaring COVID deaths.
And Anand, now the truth is
and the other thing is, if you have ILI, are you willing? Do you want to wait for 24 or 48 hours for the report to come, or do you want to know immediately?
And just so that you know, the truth is finally out. There are 862 COVID deaths in Mumbai and 466 in other districts which were not even reported. That means a total of 1,328 additional deaths have been recorded as COVID deaths, and we have been struggling for this for 3 months. So now please tell me, is this not a collapse of the administration of the Maha Vikas Agadi that they call themselves? This is a Maha Vinash Agadi. This is clearly, there's no dignity of death. When we talk about hospital beds, yes, but do you realize the way the cases are increasing, they're not going to be in a position to even provide for the most serious cases, the beds. So I don't understand what the BMC is talking about and who is guiding them, because obviously there is no thought behind this entire process.
I'm just also asking you, China, and see, what will you do if you have an ILI? If you have symptoms, will you not call your doctor? Will you not go to a doctor first? That doctor will say, go get yourself tested at the lab, and then you will go back to that doctor and take the doctor's advice. Sanjay Jha, didn't you follow the same SOP, sir? If that is the case, who's the health minister to decide? No, you will not know if you are COVID positive until we tell you.
Anand, that what you said is absolutely right. I mean, people go to the doctors tell them exactly what is to be done. The doctors actually prescribe the medication during home quarantine, tell you whatever is the standard protocol to be followed. And I do believe that, maybe there's a panic because Mumbai has seen a lot of escalation. But I also want to tell China, this is not the time for us to really indulge in any political kind of aggression. It is a challenge, yes. It is something, it's a baggage of poor public or medical health infrastructure. That's really a monumental challenge for every government all over the country. But we should remain convinced that there is a need to reduce panic. But you are making life difficult, no? Sanjay, I do believe the intention is to make sure that
you are saying we are a mess together.
To those who need it.
Anand, they have our support totally, but if they...
Sir, if we are standing in quicksand, sir, we don't dance on quicksand, sir. We do absolutely still, and we lay back so that we are pushed out. We don't dance because we only sink deeper. This is exactly what's happening.
No, I'm very sure that, and I'm very convinced that, at this point of time, there is a lot of learning happening through trial and error. And you can see the track record, whether it's a central government or state governments, they have all had to amend so many rules and regulations because, it's a tough one. I mean, this is so, to use the cliche, unprecedented.
No, but there's got to be some thought, Sanjay.
I'm not condoning
Sanjay, I am talking as somebody who's fallen sick, and what my reaction is. I am asking you very clearly, you went through the symptoms. You look at your own SOPs. Did you rush to a hospital, sir? Or did you stay in home quarantine? Did you not follow the doctor's advice? Imagine you went to get yourself tested and I turn around and tell you, sorry, तुमको report नहीं मिलेगा. जब तक BMC से phone नहीं आता, BMC से जब phone आएगा तब देख लेना.
और BMC को कैसे पता चलेगा?
No, I do believe.
How will BMC find out?
The
BMC is telling the private labs. The private labs have to report to the BMC. The BMC will collect that report. It will go through the report. It will then decide whether this person needs to be admitted to hospital. They will then call this person. अच्छा तुम COVID positive हो. हम decide करें तुम क्या. ये कितना time लगेगा सर? मुझे बता दीजिए. 24 घंटा, 48 घंटा, 48 hours after the test result is over. I have got ILI. I have got symptoms. I have no clue what's happening. Sir, even if I were to be able to recover properly, I will go, because of my tension itself, I'll further aggravate my symptoms.
Yeah.
What's going
Anand,
on?
Anand, there is a valid point here. One is the reports need to be having a quicker turnaround time. You don't want people to be anxious and buried down in hopelessness. And I think I agree with you that it's very important at the same time. And I mean, just to let China know that the protocol is that the BMC must know around the same time or earlier than the individual patient, for the simple reason that it has a responsibility for that individual to make sure the individual gets access to hospital facilities, because ultimately this is a government responsibility. So I really feel as long as it is executed well, it's fine.
Sir,
but there's no
my point point is they should know at the same time. There should be no withholding of information from somebody who goes to get
And the
themselves tested.
patient
That's
should
my
be
point of
allowed
view.
to
Thank you very much, China NC and Sanjay Jha. Thank you very much. Thank you very much. Have to wind up. That's all we have time for in this edition of The Right Stand. Stay with us here on CNN News 18. Zaka Jacob with Brass Tags up next.